Hello everyone, so welcome back to my channel. So in today's class we will be going to discuss about the kidney anatomy and physiology. So as we already know that kidney are bean shaped organ of the renal system. So the shape of our kidney is like a bean and it is 11 centimeter long, 6 centimeter wide and 3 centimeter thick, and each kidney weight is about 150 gram. So in total both kidney will give around 300 gram of weight. Then let us see the location of the kidney. So it lie on the posterior abdominal wall. So it lie on the back side of the abdominal wall, one on each side of the vertebral column. So the kidney is located on the both side of the vertebral column below the diaphragm. So this diaphragm, it is a respiratory muscles, so it is located below the diaphragm. Right kidney posterior to liver, so right kidney is located back of the liver and left to posterior spleen. So left kidney is located to back side of the spleen, and it is between the thoracic 12 to lumbar 3, and the right kidney is slightly lower than the left kidney because of the space occupied by the liver. So the right kidney is slightly lower than the left kidney because of the size of the liver, and the space in which the kidney is located, that space is known as the retroperitoneal space, that is behind the peritoneum. So peritoneum, it is a space which contain the abdominal organs, and the kidney will be present in the retroperitoneal space. Okay, now let us see the functions of the kidney. So as we have already learned in our previous classes that the function of kidney is to form the urine or formation of urine, to maintain water and electrolyte balance, and also the acid base balance. The third function of the kidney is the production and secretion of erythropoietin and the renin. So we have already seen in the previous video also that erythropoietin will help in formation of RBCs and renin will help in controlling the BP in a human body. So let us see the gross structure of the kidney. So in this picture you can see the longitudinal sections of the kidney. Okay, so kidney has three areas, that is the outer fibrous capsule, the middle one is a cortex, and the inner is a medulla. So this orange color, I have put orange color here, so this indicate a outer fibrous capsule which surrounds the kidney, and the middle one is indicated by this pink color, which is known as a cortex, and inner one is the medulla. So it's shaped as a pyramid, so this one is a medulla. Okay, so the kidney has a three main area, that is the outer fibrous capsule, middle cortex, and the inner medulla. So when we see microscopically, so there we will see a nephron. So nephron, it is a urine producing functional structure of the kidney that span from the cortex and the medulla. So when we see microscopically the kidney, we will see a structural unit or functional unit of kidney, that is a nephron, which will be present in both cortex and the medulla. So pyramid, so it is a pale conical shaped striation. So you can see a striation which is present in a pyramid. So this one is a in a medulla, and also a hilum. So hilum, here you can see this part is known as the hilum. So from hilum there will be entry of the renal artery, and the renal vein will be leaving from the hilum area, and also the ureter will be leave from the kidney. So in this hilum, the three main structure that is present where renal artery, renal vein, and the ureter. Okay, so let us see how the urine will be formed in the kidney, and it will pass down to urinary bladder. So first the urine will formed and passes through renal papilla, so towards the minor calyx, towards the major calyx, and from that major calyx 2 to 3 major calyx combine forming the renal pelvis, and then to ureter. So with the help of diagram, let us see. So you can see here the renal papilla. So from the renal papilla, it will go on to the minor calyx. So this part is a minor calyx. Okay, so this one is a minor calyx, and from the minor calyx it will move on to the major calyx. So this one is a major calyx. From that major calyx, 2 to 3 major calyx will form a renal pelvis. So this bigger one is a renal pelvis, and from that renal pelvis it will go on to the ureter. So again, let us repeat that. Firstly, the urine will form into the nephrons. Then from nephron, it will move on to the renal papilla. So this green color one is a renal papilla. So from that renal papilla, it will go on to the minor calyx. So this small striator one is a minor calyx. From that minor calyx it will move on to the major calyx. So this portion is known as a major calyx, and from that major calyx it will form one renal pelvis, and from that renal pelvis it will move on to the ureter, and from ureter it will go to the urinary bladder, and from that urinary bladder it will going to void out, or it will be going to excreted from our body. Okay, so let us see the blood supply of the kidney. So of the kidney is done by the renal artery, which is a branch of the abdominal aorta, and the venous drainage is through the renal vein that will merge into the inferior vena cava. So with that we will be going to end this today's video. So in next class we will be going to discuss deeply about the nephrons, ureter, urinary bladder.